things over to Quasi Rollins.
Thanks, Pele, so much, and LaShonda in the background making all of this happen from the IEL team. I'm Quasi Rollins, the Senior Vice President for Leadership and Engagement at the Institute for Educational Leadership, a proud partner in pulling off these webinars with Attendance Works and actually in working on chronic absenteeism all over the country. Today's topic is a welcoming and healthy return to school, ensuring showing up. That's all of us. This is the third of 4 webinars. I think you can go to the next slide. And obviously a popular and an important topic. You'll hear shortly from Hetty Chang, who is our Executive Director of Attendance Works, and I'm also a member of the Attendance Works Advisory Board. So I'm very much involved across the board now on these issues. I think you can go to the next slide. About IEL, I think most of you know who IEL is now. We're almost 60 years old. We've been working on a range of issues for many, many years related to education, leadership, community schools, youth with disabilities, family engagement, school leadership, principal leadership, all of the kind of intersecting issues that are important to improving outcomes for children, youth, and families. We are doing our best to work with folks locally to improve their process, to improve their practice. And one of the core issues that we're all working on across the country is chronic absenteeism. Next slide. And Hetty will say more about Attendance Works. Attendance Works is really the preeminent organization, thought leader, the leading voice on this issue. And a special thanks to Hetty and her team for just doing great work to kind of keep us in the loop, to keep us updated on the latest data. You can go to the next slide. And to just kind of educate us on how best to address these issues. And this webinar series is a part of that process. We have a great agenda. We've got great presenters, Gloria Corral, president of PK, Parent Institute for Quality Education, Elliot Atasha, who's a pediatrician and a senior fellow with Attendance Works. We'll hear from practitioners like Erin Helgren, who's a principal, and I found out today also a social worker. We need more social workers in this work. And Naomi Tolentino, who works with Kansas Public Schools, coordinating student support programs. So got a great agenda, great insights. You can go to the next slide. I want to thank all of our convening partners for this year's Attendance Awareness Campaign. You can see all of their logos there. Campaign for Creative Reading, Everyone Graduates, Future Ed, National League of Cities Mentor, Healthy Schools Campaign, United Way. And you can find a full list of partners on the Attendance Works website. Next slide. And we've got a brand new state collaborating partner, the Connecticut State Department of Education. Welcome, welcome, welcome. We have enjoyed being on this journey with you, learning from you, and walking with you as we do this work. Next slide. This year's theme, showing up together. That says it all. We all have got to show up. That means the adults and the kids. All of us got to show up. Next slide. So as I mentioned, this is the third of 4 webinars. You can still find the recordings of the previous webinars on the Attendance Works website. This one, as Pele mentioned, will be available shortly after the webinar. And then we have our final one in the series in late September, where we'll look at bright spots. Next slide. Key messages, you know, every theme requires a couple of good bullet points that you can use. We know that at the core of everything, it seems, is building strong, trusting relationships, building a sense of belonging. All of that is fundamental to engaging students, to improving attendance, to all of the outcomes that we want so dearly. We know students are more likely to attend school if they feel safe, connected, and supported, and we need positive problem-solving approaches that are driven by data to improve attendance, not punitive approaches. And all of us have to work together. I think that goes without saying. And we've got to do more than agree that it's a good idea to work together. We actually have to work together. And so next slide with that, I'm going to turn it over to Hetty, who I call our fearless leader earlier jokingly, but we've worked together for a long time. Hetty, take it away, and welcome to a great webinar.
Thank you, Kwesi, for starting us off. And we also want to do a quick thanks to our corporate sponsors, Kaiser Permanente, School Technology, and Rawi. These corporate sponsors really help to make these resources available, and you can see a little bit more about what they do on this slide. Let's go to the next slide. I also want to just acknowledge that, you know, reducing the levels of chronic absence right now, it's going to take a continual focus on engagement and support, and the rebuilding of those routines, so crucial to recovery and making sure kids, especially those most adversely affected, are going to be able to benefit from our investments in recovery. And we just would love to make a quick pitch, ask that you might consider donating to us today so that we can help advocate for this ongoing attention to attendance, because the crisis that we have is bigger than ever, and we got to make sure that we continue to invest in this, and that we, Attendance Works, can make available the kinds of free resources we're making today, our webinar, new materials on our website, which serves over 400,000 folks. And if you can make a quick donation to allow us to keep up this work, we deeply appreciate it. Next slide. So next slide, please. As I mentioned, we face an attendance crisis. Pre-pandemic, maybe about 8 million kids, 1 out of 6 kids were chronically absent. We don't yet have national data, but the data we do have from states shows that it's higher than ever. In many states, it doubled, often affecting more than 1 out of 5 kids. And early data from places like Connecticut and the districts, some of the ones that we're working with, we're seeing that chronic absence, while it's a little better, remains extremely high. And those kids who are particularly facing economic disadvantages, have a history of being marginalized, Native American, Black, Latino, Hispanic, Pacific Islander students are disproportionately affected. And it's so high in our early grades as well as throughout high school. And if you go to the next slide, you can see the kind of crisis we're seeing that starts early. And these are kids who, you know, have had multiple years of disrupted learning, maybe didn't go into preschool, and the long-term consequences, both of high school dropout and kids not getting the supports they need in these early grades, are going to really require intentional focus and support so we don't have adverse long-term consequences. Next slide, please. So key to solving this problem is shifting our mindset. We have always kind of thought about, historically in this country, of chronic absence as truancy, which looks at unexcused absences only, kind of as a compliance-focused approach. And we tend to take legal, more blaming, punitive solutions, when what we really need to be saying is all absences matter. And the problem with absence is that you're missing out on learning, missing out on access to resources, missing out on socialization. We need to take a prevention-oriented, problem-solving approach that cultivates family and student engagement. Next slide. And we have to, as we do this, remember that when we label absences as unexcused, it can deeply affect how students and families are treated. It can result in kids being denied help or credit for homework, class credit, saying you can't participate in this extracurricular activity. And if it continues, you know, you'll get maybe nasty truancy notices sometimes, fines, legal action, which don't actually address the underlying reasons why kids are missing. And sometimes it's kind of arbitrary. Consider 2 kids. One kid has missed 5 days of school, has access to healthcare, and comes in with a doctor's note. That's excused. Child B, you know, has missed 5 days of school, doesn't have access to healthcare, doesn't come in with a note, and as a result, all of these punitive responses may come into play. Next slide. Rather than taking a punitive approach, we have to understand that when chronic absence happens, it can be a sign that these positive conditions for learning aren't in place. Physical and I'm going to just help an emotional health and safety, belonging, connection, support, academic challenge and engagement, adult and student well-being. And that when this is happening, as it is now, with such high levels, 1 out of 4, 1 out of 3, some places with half their kids chronically absent, it means these conditions are not in place.
It looks like you're back, Hetty.
Yep, I think I froze for a second. Okay, so when high levels of chronic absence, this is present for way too many sleeps. Let's go to the next slide, please. And that means we have to redouble our investments in a multi-tiered approach that begins with those foundational whole school supports that support those positive conditions of learning. And doing this requires us working across silos. Next slide. And how we put together that tiered approach requires us tailoring our approaches to address underlying challenges and actually also build upon assets that exist. But we got to understand, what are those challenges? What are the barriers kids and families face? What about, is it aversion that's pushing them out? Is it a lack of engagement? Is it misconceptions? And one misconception, for example, we'll talk about a little later today, is the assumption that happened during the pandemic that kids have to stay home for any symptom illness. We actually have to talk with kids and families to understand at a local level, and then we can also aggregate the data to see what are the biggest barriers kids and families are facing, and make sure that our tiered support systems really offers resources that address those particular challenges. Next slide. We need to tap into the expertise of students and families because their experience is what allows us to have updated knowledge about what are their realities. And when we talk to lots of kids and families, it helps us understand what might be scalable solutions and what are solutions that are really grounded in the realities of students and families' cultural and linguistic norms. Next slide. We at Attendance Works have on our website a bunch of different kinds of qualitative tools that you can use. We have a scan for environment attendance, empathy interviews, 2x10, student focus groups, attendance cafes, student parent surveys, and these are things that we offer to you, examples as free resources to help you ground your tiered supports in the realities of the kids and families in your communities. Next slide. And I want to really encourage you to, as you're unpacking, who should I talk with? Which groups should I prioritize for understanding their realities? You take a look at 2 kinds of data. One is, and this is something that we've all done a lot, look at who's disproportionately affected. Which groups have the highest percentages of chronically absent kids? And this is actually data from California. So you can see, we know African American, Native American, Latino, Pacific Islander are disproportionately. And sometimes if you look at other slides, other data will show homeless kids, kids in foster care. But then another really important way to look at this is looking at the numbers. So in California, of the 1.87, almost nearly 8 million kids who are chronically absent, a huge portion of them are Latino, which means that that's a group that we're going to particularly want to understand their realities if we want to be able to take our strategies out and make sure they're scalable, affecting as many students as possible. Again, we want to look both ways, and this will help guide you. And if you look at your local data, it'll help guide you into thinking about which groups do I most need to understand. Next slide. And this is really about taking a year-long approach, where we're nurturing, right now we're going between summer and fall. So hopefully this summer you've been engaging in building bridges, knowing which kids need more outreach. And this fall, you're going to deepen your efforts to really create community. And then later this year, going to make sure that they have support throughout the year. Next slide. So it is my pleasure to ask Gloria Corral, the president and CAO of the Parent Institute for Quality Education, to join me. I've had the pleasure of knowing Gloria for something like 25 years, work in Northern California as well as Southern California. And what always shines through in Gloria's work is her deep commitment to families, her deep commitment to making sure that we develop policies grounded in their realities. And Gloria and PK are also part of an effort with Families in Schools and Attendance Works, where we have joined together to create something called Keep Learning California. And as part of Keep Learning California, we've been deeply invested in making sure we have these pulse interviews or surveys, so that we're always, and we're doing this multiple times a year, so we're always thinking about what we should be advocating for based upon what we're hearing from family voices. Gloria, can you tell us about how PK has really been able to reach out and understand the perspectives of the families, and tell us what you've learned from that?
Absolutely. Well, thank you everyone for being here. I echo both Quincy and Hetty's sort of cheering you on as you continue this work, as you're preparing, if you haven't yet brought families back, but as you're preparing to really create the conditions that support families being included, being engaged, being welcomed, in the face of what Hetty presented, really important challenges that we need to face collectively. So PIQE is really a social justice and educational equity organization. We are national in scope, and we provide direct services specifically focused on engaging families in a linguistically and culturally responsive way to do what every family member and every parent wants to do for their child: be engaged in their child's education and be a partner with all of you and teachers and educators in making that transition and that learning environment happen both at school and at home. So that's what we do. Because that's what we do, in the next slide, I want to deepen a little bit kind of how we go about doing this as it pertains to listening intently to families. And so what we've done now for a few years is doing what we call a family needs assessment. And these are interviews with families. We do them twice a year, where we pick up the phone and ask families a series of questions so that we can then lift up their the opportunities, the concerns, the issues that families are facing. We do this work in California, where we serve approximately 25,000 families a year across the state. And this is really a way for us to partner with other organizations in California to lift up issues that may be impacting families experiencing and supporting their child's education. So that's sort of the nexus between the work that we do and why we're going to be here presenting to you what our latest family needs assessment tells us. In the next slide, I'll share a little bit about the context and the method in which we do this work. These are phone interviews, and I think that's very important. So if we can move on to the next slide, where we interviewed 980 families. They were conducted in Spanish. That's a predominantly group that we serve. And this covered the entire state of California. We felt it was also really important that we looked across the continuum of the education pipeline, right? Started with our youngest learners, so families that had our young children, all the way through upper grades and into high schools. So these were phone interviews. The next slide will share with you kind of the content areas or the focus areas that we ask families to respond to. Access to resources, so on and so forth. One really important element that we added was really a focus around student absenteeism, which is where we will deepen our conversation. There were 10 questions that we asked with multiple answers and multiple responses. So in the next slide, this gives you sort of a quick overview of the demographics of the families that we surveyed. And importantly, we think it's really important to highlight that for us, demographics really matter because, as Hedy was saying, knowing the community and not making assumptions is one vital way in ensuring that the strategies really are responsive to the families and the communities that you all are serving. In the next slide, I'll just share, you'll be able to see the overall kind of key results. These are really important for you to kind of take a look at. One thing that really harkens back is if you look, 52% of families don't have access to health services online. And that's a really important number as we think about the reasons why and how families, especially of our youngest children, may or may not be able to make decisions about the well-being of their children and making the decision for them to show up to school. The next slide, we really want to talk about what we learned specifically around students being absent. And we asked this question really understanding that even in the best case scenario, the best curriculum, unless children are in school learning, really the best approaches and pedagogy will not positively impact them. And so one thing to highlight from this data is that you see that approximately 25% of children are chronically absent. And the largest reason is short-term illness. And so this really enabled us to really think deeply about how then do we provide and support families to make the best decisions for their children, recognizing that that is one important reason why children are being kept from school. Because we were able to look at so preschool through higher ed, high school, we thought that this was a really important question to understand, as Hedy was saying, not about truancy, but really around engagement and being present. The next slide I will share with you is really about the second corollary and very important way in which we believe that having a strong understanding and having robust communication is a critical strategy that we know will impact behavior. So one thing that you'll be able to see about this is that there is a positive story here, mostly that communication really impacts the way families engage, right? And the other flip side is, therefore, we want to be able to provide families information in a way that they can access, right? And I think that's a really important point, because one thing we learned through the pandemic was that consistent multiple communication channels in a language and in a manner that was reflective and responsive to the families actually enable families to be well informed. I don't know, many of you might remember that during the pandemic, often the principal would be sending, a voicemail, a email, a Facebook post on Fridays or Mondays or Sunday nights, right? About what was going to happen, what parents could expect on Monday, right? And those are strategies that, because now children are back in person, by and large, may no longer be implemented. This tells us families want constant information, consistent information in a way that they can respond and be engaged in. The next slide really tells us that parents feel very positive about their engagement with school, with you. It's really doubling down in our efforts about providing the resources so that they can make the best choices and the best strategies that will enable them to engage positively with all of you, right, in the community. And so, one thing that I want to leave you with, it's that by fostering those positive relationships and those positive environments, That's how we can really create the environment that supports, as Hetty was sharing earlier, that opportunity to be engaged, for families to understand the importance, and to have the resources necessary to make the best informed decisions, especially among our youngest learners. Because as Hetty said, and many of us know, our youngest learners have experienced the most disruptive patterns because of the pandemic to get into those positive transition activities that have led us to have, quite frankly, much lower rates of chronic absenteeism in the past. So as we continue to shift and support families, we want to be very thoughtful about building that positive environment and building two-way communications between families and our education partners, so that families can identify the needs, support efforts already underway, and importantly, to share some barriers or some misconceptions about why and how their children are being impacted by not showing up to school. So with that,
Gloria,
yes,
there's a question in the chat, and it's also in the Q&A. Folks are asking if it is possible to get a copy of the questions that were asked in the survey. Yep.
Yeah, so thank you. Great question. Yes, absolutely. We are planning a launch of release of all of our data, and we're happy to share that information with all of you. Absolutely.
So, Gloria, I think what we'll do, I'll just let everyone know so they can stop feeling they need to send, put their emails in the chat.
Yes.
Know that we will, when we send out this information, we can give folks access to a copy of the survey. And then I know, Gloria, we can maybe put a copy of a link to the findings, even
That's
the fuller set of findings. So we will send that out along with making sure that everyone has copies of the recording and all those materials, which will then also get posted on the Attendance Works website.
Wonderful. Thank you, Hetty. So the final slide, I just want to say that this was a team effort. I want to thank our partners, and I want to tell you that this is really how, in our work and in your work, this community approach really enables us to have an opportunity to not just learn from families, but importantly, be responsive and be creative about the ways in which we respond to their needs. So thank you so much for the opportunity. I look forward to engaging in questions.
Great, thank you. And Gloria will come back at the end. We now, it's my pleasure to invite Dr. Elliot Atisha to join us. Dr. Elliot Atisha is someone who I got to know first when he was running school-based health clinics in Detroit. Then he was the chief medical officer, and he was also the co-author of the American Academy of Pediatrics position statement. When the pandemic hit, I knew we needed some different kind of expertise, and we invited Elliot to join. But Elliot, one of the things that came out of that survey that Gloria just showed is how much illness, short-term illness, is something that is such a cause of kids missing school. Can you tell us a bit more about, it seems to me that you've done a lot of work that shows we don't have to accept illness as something that we can't address. We could actually reduce the number of illness-related absences. Can you talk to us more about how you understand that issue, why it matters, and what we can do?
Absolutely. Thank you so much, Hetty. I'm excited to be here and to speak on the connection between health and attendance. One of my favorite quotes comes from the National Association of State Boards of Education. Health and success in school are interrelated. Schools cannot achieve their primary mission of education if students and staff are not healthy and fit physically, mentally, and socially. So on the next few slides, we'll briefly go over tips that connect to key areas of nutrition, sleep, exercise, hygiene, safety, wellness, and engagement, all of which help students to stay healthy and in school. And I may have skipped ahead a little bit. Next slide, please. All right, so nutrition, sleep, and exercise are key to a healthy lifestyle. And this goes for adults too. And yes, everyone on this webinar. It's important to maintain routines, which includes breakfast every morning, a regular bedtime, and physical activity every day. Next slide. So good hygiene, including hand washing at appropriate times and covering coughs and sneezes with tissue, can help reduce the spread of germs and create a healthy and safe learning environment. It takes a team effort, though, to reinforce these practices and to ensure protocols and resources are in place. Next slide. Safety is also a priority when it comes to keeping kids healthy. In one study, 40% of kids who were killed in an auto accident weren't wearing their seatbelt. And roughly 600 kids a day end up in the ER because of bicycle injuries. In addition to reinforcing seatbelts and helmets, we must also ensure that students who walk to school have a safe route and a backup plan in case of bad weather. Next slide. Families, schools, and health providers can collaborate to keep kids healthy. This includes ensuring access to routine physicals, dental visits, and management of chronic health issues. If we look at dental issues alone, cavities are the #1 chronic disease of childhood, 5 times as common as asthma, and yet they are preventable. Such dental issues can lead to tooth pain, which can contribute to a significant number of missed school days. School nurses, social workers, and other health team members can play a huge role in making sure that families are connected to health-related resources. Next slide. So as we work towards creating a healthy learning environment, it's especially important for children, for all children, to complete annual health forms, or for their parents, sorry. This allows schools to be aware of health issues facing their students and to provide appropriate supports and resources. One example is asthma, which contributes to over 13 million missed school days annually. I'm gonna repeat that, 13 million missed school days annually. All children with asthma should have access to an asthma action plan and rescue inhalers while at school. But this requires a coordinated effort. Schools must also have policies and protocols in place to support students with disabilities and those who may need to stay home due to a prolonged illness. Next slide. Last but not least is engagement, which is key to keeping kids in school. And this starts with creating a safe and welcoming environment. Kwesi stole my thunder here, but I'll add a few more brief bullet points. More than 15 million students are alone and unsupervised between the hours of 3 and 6 p.m., peak hours for risky behaviors. Encouraging participation in after-school activities can help avoid such behaviors and impact the students' overall health and engagement in school. And as Gloria mentioned and talked about, families, of course, play a big role in student engagement, and it's especially important to keep them informed about their child's attendance and academic progress. Next slide. So the tips that I just shared help to prevent students from getting sick in the first place. But we also know that with such efforts, students still do get sick. That even with such efforts, students still do get sick. And during the pandemic, we, for good reasons, became very cautious about keeping kids at home due to illness. Though COVID is still with us, we've made significant progress in reducing its impact. We must change our behaviors to reflect that progress and get children back to the regular routine of school. Attendance Works is super excited to share our most recent parent and educator resource, which is up on the screen, Health Guidance for Going to School. This resource was made possible through collaboration with Kaiser Permanente and the National Association of School Nurses. It's based on existing research and guidance and went through review and feedback from school health experts across the country, along with parent focus groups. And it's also translated into Spanish. The front dispels some of the myths around reasons to keep kids home and talks about the importance of seeking out support when it comes to things like anxiety and students who are immunocompromised. The back has a nice table that goes over some of the common symptoms that might require a child to stay home or seek medical care, and also when it's okay to return to school. Next slide. So we encourage schools to share this resource with staff and parents. One suggestion is to incorporate it into back to school packets. But knowing that forms may not always make it home or end up in a packet that quickly becomes information overload, schools can also use technology such as robocalls, text, student information system applications, and awareness campaigns to reinforce the messaging. Before sharing this resource with families, please take time to share it with staff so they're on board with the guidance. We also suggest using these materials to start discussion with your local health department about whether updates might be needed for local guidance. Next slide. Don't forget to also draw upon and share Attendance Works' recently developed parent resource on the connection between anxiety and missing school. It provides an overview of anxiety symptoms and steps that parents and schools can take to work through the challenges and help get the child back to school. Next slide. So, in summary, healthy students are more likely to attend school. They're better able to stay focused and engaged. They're more likely to be ready to learn. Healthy learners are healthy students. It takes a village, though, to do this work. Key to making it possible is ensuring that the messaging is consistent, coordinated, comprehensive, and culturally effective. Please make sure to visit Attendance Works website for additional information and resources to keep our kids healthy and in school.
And Elliot, before we go on, I want to tackle two questions. And one is, what does an asthma action plan look like?
Sure. So the more common, thanks, Eddie. That's a great question. So the more common asthma action plan that's out there are many versions that are out there, but the more common one is the green, yellow, red version. Green is when you're doing well, your asthma is under control, you're taking your daily controllers if you're on them, depending on your severity of your asthma. Then yellow is when you're starting to get into trouble and you're starting to need your rescue inhaler, and red is when you're seeking out care because you're in a bad place with your asthma. And so we need to make sure that every child who has asthma has an asthma action plan on file, and that's created by the primary healthcare provider or the asthma specialist. So making sure that an asthma action plan is on file allows the school to know what to do in certain situations if the child's asthma flares up. And most important is also to make sure that every child with asthma has a rescue inhaler on file and permission to keep that medication at school. Some kids might be old enough to carry it around with them. Others might need to have it stored at the main office and someone knows to give them access to it when they need it. But there's a lot of coordination that goes into that. It's training of staff to know how to identify an asthma flare-up. It's the school nurse, if your school has one, coordinating all the pieces around it. And it's parent engagement and making sure that the parent is updating the school whenever there are changes to the child's asthma action plan. Great question.
Thank you, Elliot. There's one second question. I know I'm taking a little bit of extra time, but they're so health related. I thought it was helpful to do it at this moment.
Sure.
Elliot, there's another question, which is, so can kids really go to school with lice?
So yes, they can go to school with lice. The recommendation is if you identify lice, that it's okay for that child to stay in school through the end of the day. That child should go home and be treated so that when they come back to school, that treatment is at least initiated. But lice is not a reason to keep kids out of school. As much of a nuisance as it is, we need to make sure that we're doing everything possible to keep our kids in school and to not create stigma around lice.
All right, thank you so much, Elliot. Elliot and Gloria are going to come back, but it is now my pleasure to shift to sort of part two before we go into Q&A. So you've now just heard about the parent voice, you've just heard about health-related research, health issues, and now it is my pleasure to ask two amazing practitioners to join us to talk about how does this work really play out on the ground. So first, we're going to be hearing from Erin Helgren. Erin is the principal of Yancala Elementary School in Oregon. Erin brings to her work years of experience as a social worker and community organizer, and that truly informs her understanding of the symbiotic relationship between family engagement and learning. And she brings this holistic perspective to Yancala, where she is now principal, and she's actually a new principal, but she's been working there for years as the early sites, as part of the Early Works Initiative supported by the Children's Institute in Oregon. And then along with Erin, we're going to be hearing from Naomi Tolentino. Naomi is the coordinator of student support programs of the Kansas City, Kansas Public Schools. She oversees multiple programs there, including Attend to Achieve, Positive Alternatives for Children in Trouble, and their wraparound supports. And I will just say what I've deeply appreciated is that Naomi has been our partner in the work in this district. She's compassionate, she's tenacious, and she has really been the glue helping to keep work moving along. And every district and needs glue folks and leadership that, like what you'll see from Erin and Naomi. Erin, will you join us and start by telling us a little bit about Yancala, about the and let's go to the next slide. You can just see the question about the demographics of your community and its chronic absence rates. And so let's go to the next slide after that. And Erin, thank you so much for joining us.
Thank you. So my name is Erin. Thank you for the introduction. And I work in Yancala, which is a small rural community in Southern Oregon. We have between 1,100 and 1,200 people that live in our town and outlying area. And we have about 280 students enrolled in the district, with 160 students at the elementary school, kindergarten through 6th grade. 100% of our students qualify for free and reduced lunch, and our community is predominantly white. And next slide. Like many rural schools in Oregon, we have a very high rate of children that are experiencing chronic absenteeism. And it was amplified during the pandemic. And as you can see, nearly 93% of our kids missed 10% or more of their school year last year. And we're making small incremental gains each year. Next slide.
Thank you, Erin. And I just wanted to showcase, we wanted Erin to be here because sometimes you start at these really high levels and you got to keep moving and getting them better. And that is also success that we have to recognize and celebrate. So thank you, Erin, for sharing that with us. And so can you tell us a little bit, Erin, and I think it's also helpful because you come from this rural community, and that might help us understand that context. What have been the major causes of absenteeism in Yancala, and what have you seen that is helping to get those improvements?
So I think historically, when you work in a rural community and you see such high rates of absenteeism, as an educator, you make some assumptions about the community. And I think prior to being really curious about understanding, we had these assumptions that maybe people didn't prioritize education. But when we became curious, and we started actually engaging with families in a very authentic way and creating safe ways for them to share their lived experience. What we understood first and foremost was that families didn't feel connected to the school. So if you could, next slide. And so our families felt a lack of relationships and connection with school and staff members. And so the very first thing that we did is we really listened to the community and asked the community, what are some of the things that we can do to support connection? One of the things that we've been doing for the last 5 or 6 years is really engaging families in decision-making for the district. And so we have a very active site council. We have curriculum adoption teams. So as we're making decisions for students, they are included in our adoption process. We do regular parent cafes that tackle some of these assumptions around attendance and other things. We have family leadership groups, and we really view our parents as consultants. So I think oftentimes, we can't do good work without input from our families. One of the things that we've been doing for the last 5 or 6 years are home visiting with our staff pre-K through 6th grade. And so I say that they're relationship building home visits. So we're really there to build strong partnerships with parents. So what do we need to know about your child and your student? What expertise do you have to share with us about how to best serve your student in the school context, in the educational context? Another strategy is we've really embraced this grow your own. And so we actually have parents that have started working in the school that are going back to school to get their degrees to actually teach in the community that they live in. And then we start serving families at birth. We recognize that birth to 5 is an incredible opportunity for relationship building. And when most of our parents now that are coming into the building at kindergarten have had sustained relationships starting at 2 or 3 years old in our building. So kids are familiar with the building, and parents are familiar with the building as well. The next thing that we acknowledge was a barrier to family or to students attending, next slide, was lack of access to resources. And so our parent group actually identified this and began writing grants to create what they call a care closet. And so a care closet not only has basic needs supports and toiletries, but they have clothing and backpacks and socks and underwear and all of the things that a student may not have access to. And we take a universal approach. So there doesn't have to be a demonstrated need financially. So if a child has wet socks, all children go in and they get a new pair of socks. We have started providing food for students to take home if they need it. And so families and students are accessing our food pantry. We actually did a community health and needs assessment just with our community, because oftentimes a remote rural community can be lumped in with the county, and maybe the county isn't demonstrating need, but the town itself is. And so we did a community health and needs assessment that identified that our number one barrier for students in coming to school was lack of access to healthcare providers and mental health providers. Prior to our work with our local health providers, our health clinic was 28 miles away, and we didn't have any way to get families there. And so through this needs assessment, we were able to leverage our partnerships with the local health providers, our community health agencies, and bring medical services into our community 2 days a week. And so families and children can actually see a doctor in their community. And not only did we use our community health and needs assessment to leverage for those services, but our families actually walked alongside and talked about what they needed in a healthcare providing setting. They needed after hours care. They needed to be able to see doctors on Fridays. They needed pharmacy services and things that our local health providers weren't aware of. Most recently, we've begun to partner with our rural residency program to bring in health-related classes and series. So we've done a social emotional learning health partnership, and we're also doing cooking classes for our families. The other thing that was identified in our community was that there weren't really things for kids to do after school. And so the school district is supporting our Young Call Youth Sports by not only helping with funding and helping with equipment, but also providing space and partnering with transportation and local health services to triage kids into sports physicals. And then it really has been shifting this thought that the school is a fortress to really saying, actually, we know in a rural community that the school is the hub of the community. And so we're opening our doors to not just educational related services and activities, but also to other groups. We have a sewing group that comes in on Sunday. And so it's a part about building that community and building a healthy community. Next slide. So this is a framework that has really driven most of our work here at the elementary school. And so we know that all of these health and community resources, family partnerships at home, at school, and supports for staff development are all an integral piece of children being ready for school and learning. Next slide. Most recently, our building has adopted this framework to really pinpoint, our approaches to thinking about attendance. And we're really understand that there's such a relationship between a vibrant community, stable families, and successful children. And so how are we not only providing academic opportunities for students to learn, but how are we contributing to a healthy, vibrant community? This last year, when we saw like the highest percentage of gains, when we talked to students about why they need to come to school, why it's important to be in the building, we included building a healthy, vibrant community because we know that that's important to not only our students, but our families. So we would say we come to school so we can learn, so we can practice, but also so we can make connections with our friends. And so we're part of contributing to our healthy community of Yoncalla. We really not only are asking parents to be part of the solution, but also asking teachers, like, what are some of the things that you're seeing that will build a strong culture of attendance in our building and help students be successful? And our teachers are celebrating small successes. So when we're seeing gains in attendance, and maybe we're not exactly where we want to be, but if we see kids that are coming to school more, we're celebrating that. And we're doing things like after school tutoring, which yes, is providing some academic support, but also is helping to build strong relationships between a small group of children and the teachers. We're looking at data together and asking questions and really thinking about actionable strategies. And then we're also having difficult conversations in a relational way. And so it's not passing judgment or shaming. It's about how can we support, because we're assuming positive intent. We're saying that we believe in our heart of hearts that parents want what's best for their students. How can we support them in really addressing some of those barriers?
Erin, thank you so much. It's such an incredibly rich picture that you painted for what's happening at Yoncalla. Erin, one person in the chat asked, are you at the site or the district level?
So we're a very small district, so it's very intertwined, but I am at the early learning and elementary site and work very closely with the high school principal and superintendent.
And that's my segue to bringing on Naomi, because Naomi is actually working at the district level. Let's go to the next slide. So Naomi, can you tell us a bit about Kansas City, Kansas public schools and what you've seen around your chronic absence data? So let's just start. Give us a sense of your community. Next slide.
Absolutely. Thank you, Hetty. And thank you everyone for showing up here. It starts here, right? In this kind of conversation. This is what helps us. So thank you for being here. So Kansas City, Kansas Public School, what can I tell you? A lot. So KCKC PS is our urban public school district. We are one of the largest school districts in our county, Winder County, which is in Kansas City, Kansas. If you know a little bit about Kansas City, you know we have part in Missouri, part in Kansas. We're in the Kansas side, and we are actually the 5th largest school district in Kansas. We have I believe over 22,000 students enroll. We have 28 elementary schools, 7 middle schools, 5 high schools, and 6 alternative sites. And one of the unique things about Kansas City, Kansas is the diversity. We have a very diverse community here in our county, which means different needs, different challenges, which is also a beautiful community. We do have our largest population is Hispanic. We're 55% Hispanic, around 25 African American, 9 white Caucasian, and then we have 6 Asian, and then others. So we have over 65 languages spoken in our district, which is a beautiful thing to work with our community. So in our data, looking at our data, I want to show you an overview of our chronic absenteeism data on the next slide. So this is where we were in 2019. We had a high number. We still have a high number of chronic absenteeism. during the pandemic, we were, as a lot of other districts, we hit us hard. We definitely saw a disengagement with family, as a lot of you have seen. Our chronic absenteeism number did not increase. So we've been working very hard to put things in place as a system, right? And we have seen a decrease on chronic absenteeism in the last year. We still have a lot of work to do, but we are going to celebrate those small wins for sure.
That's a
Because
12% decrease over
it is.
like almost 13%. So Naomi, that is not, again, a lot of us are facing lots
Yep.
of challenges. We got to be able to appreciate when we're making gains. So thank you.
Absolutely. And how do we see this data around grades? In the next slide, you can see our chronic absenteeism by grade. And I want to show you this because it's also, again, looking at data, it's what helps us make the right decisions, right? So looking at the data of the of year 21-22, you can see that we have seen numbers very similar to what we see nationwide, right? Kindergarten, we have high chronic absenteeism. Elementary, it decreased, and then elementary and high school, something happened that our chronic absenteeism is increasing. We did see a decrease of chronic absenteeism in our elementary, which are our smaller schools, less staff, less students, and I feel like implementation of some of the things have been easier. Where high schools, we still have some work to do. We did see, when we look at the data by school, we see some high schools actually decrease the chronic absenteeism. So this is our unique grade chronic absenteeism.
So what have you guys done? What have been the challenges that you were trying to respond to as a district? And what are the strategies, and let's go to the next slide, that you found that have worked?
Absolutely. If I talk about the challenges and all the things that we are doing, I will go over time. We have seen a lot of things similar as Giancarlo, but I think one of the things that we did recognize as a district is that we have a lot of schools doing amazing things. We have great things in place, but we did not see consistency across our buildings. We have 43 buildings, and we noticed that some schools were doing good, some chronic absenteeism in schools were, their numbers were amazing, but as a district, we were not really clear on what was that difference between 88 and chronic absenteeism. We were not looking at data as a district to chronic absenteeism because we did not have a way to look at chronic absenteeism. So for years, we focused on what we had, which was truancy. Our district focused all the efforts on truancy students, looking at truancy numbers, working with the court, but there was no really a way to identify those trends by buildings because we have no data. So that was a big challenge that we saw as a district. So when we were thinking about how do we help our buildings, we need to look at the data by building, we need to look at trends, we need to be able to do that. Because then, of course, that help us identify that we did have a lack of foundational support in some of our buildings, right, that we needed to address. So what do we do to address those challenges? That we basically decided, okay, we need to stop. And in the next slide, we'll share a little bit short about our partnership. Next slide, please. So we established a partnership with Attendance Work and Red Apple Corporation. We knew that we needed the experts on the table. So we had conversation. We actually attended one of this webinar and we're like, we need this in our schools, right? So we definitely decided that we needed to have those conversations, and we as a district, we needed to learn, we needed to know, but then we also needed our building leaders to learn about chronic absenteeism and help us shift from truancy to chronic absenteeism to more intervention, more prevention models. So we created a partnership where we started working with 20 of our schools. So the last 2 years we've been working with 20 of our schools. This year we're going to start working with all of our schools, so we're very excited. And in that partnership, what we did was a lot of professional development. We provided professional development to building leaders throughout the school year. We also provided coaching. This is what Red Apple Corporation came and helped us do that in-person coaching. So we met monthly with those 20 schools. We look at the data. We also provided, took a lot of the resources that attendance work provided to us and worked with that. We help our buildings also listen. I've heard that a lot. We listen to what our families needed. We listen. We did our cafes. We did surveys. We start helping our buildings learn your community, because one thing that we noticed is that every building was very unique and the needs of each building was different. So listening was the key part of our work. And another thing that we did is we collaborated with our trauma sensitive and social emotionally team to provide MTSS training and implementation. So we actually created our Atlas protocol. So this is and I will share that. I realized I didn't link that to, but I will link that to the presentation. But this is a tool that we adapted from the National School Reform Faculty Harmony Education Center. And it's a tool that helps us look at the data with that equity lens and see what is really missing from a data. What do we really need to do? So we have each building use that protocol to look at data. Next slide, please. So professional development, coaching, and another thing that we did is, as a district, we have our truancy team, which we changed and we created our Attend to Achieve team. So we restructure our team in our district to focus again on that prevention intervention. So we don't we try to take away that word from truancy from our district and more like attendance matter, right? Attend to achieve. So we did that and reorganized our district. And then the biggest part is that during that coaching meeting to our buildings, we help building establish an attendance team. That attendance team, again, is looking at data, listening to families, but then also providing what the families need at each school. With that, each attendance team created an attendance plan. We, again, used the resource that attendance work gave us and adapted it to us. And we created an attendance plan to make sure that each school has foundational support, tier 1, tier 2, tier 3 that meet the needs of each building. And next slide, please. Another thing that we did as a district, again, when we noticed that we were missing that consistency as a district, we worked with attendance work to create an attendance guide, and it is linked to the presentation, so you will have access to that. And this attendance guide also, it's not just to give us information on how do we take attendance, but again, it has a lot of resources that our schools can use. Now, one thing that we did, which was really unique, and I love it, is that what we did is like we talk to our buildings and look at what is working in your buildings. And we try to connect buildings with other buildings and say, hey, morning meetings is really working well in this building. You know what? This building is just giving treats in the morning to our parents when students bring them to school. And it actually has decreased the tardiness. And we start talking about what is working, and we compile all those resources and we put them in an attendance guide. So all the buildings have the resources that are working for our district. So it will be linked in the presentation. You will have access to that, and hopefully it's something that you can look at it later. So next slide. I think there you go.
So
okay.
I wanted to now have Erin and Naomi talk about a couple questions together. So one question is, how do you see the difference? And Erin, maybe you can come on screen too. What do you see as some of the difference between secondary kids and working with elementary students?
So I can go ahead and get started. So working in our district, as you see, our attendance, chronic absenteeism data, it's very different in elementary than high school. So working with elementary across the building, across the district, we noticed that family engagement, students feeling welcome was one of the things that we saw, right? Across working with elementary was a little bit easier for us as a district because of the small district. It was easy to train staff. It was easy to connect with family and build those relationships. When we went to high school, the challenge was a little bit different because our high schools are large. We have high schools that have 1,500 students, 800 students, and training all that staff and making those relationships relationship was a little bit harder. So what we did in high school is that we're working with our high schools to address chronic absenteeism and increase engagement by either academy. So our high schools are divided by academy or by grade. So the teams are meeting monthly to look at the data and look at subgroups to then build relationship. That is actually helping a lot. In one of the high school, we focused actually in 9th grade, and with the team of 9th graders, we met every month. We look at the data, and we saw that there was a difference. And looking at by subgroups really helped us to implement and find strategies for our high school. And I know Erin works elementary, so she can tell us a little bit more about that too.
So I would definitely agree as far as difference between high school and elementary school, but I'm also going to share our unique experience of working in a small community where we have really tight connections. Is we are really rethinking are encouraging our high school staff to rethink the parents' role in the building and building relationships. So we have spent 10 years with some very, very explicit relationship building strategies for the elementary school and our preschool, and we're scaling it to middle and high school. And we're challenging staff's assumptions that parents are no longer willing or able to be involved in their high school students' career. Now, it may look different, but you know, I'm going to guess that we have families that are coming up through our elementary school that are going to have an expectation that they are building relationships and understanding the lived experience of students in middle school and high school. And so we're doing things like implementing home visits at the high school level and, you know, encouraging teachers to do that. We're looking at district-wide strategies in relationship building. And so again, it does look different. One of the clear differences for me is that our students, because we live in a small community, have a little bit more agency. And so we can work directly with students to address some of their barriers to getting to school and work directly with students when we need to.
And I will add really quick, Hetty, and you asked this question, and I think we've heard a common language of listening, right? One of the things that we did over high school was like we asked our students, you know, we created a survey and we asked our high school student, what is keeping you from coming to school? And we were very surprised with the answers. And a lot of the teachers and high schools were like, oh, you know, some of our students say, you know, there's no one home to wake me up, so I don't go. So how do we fix that, right? So it gave us a lot of insight knowing, like, so asking the students is very powerful too. So not just asking the parents, but asking the students, it will be something that I recommend for secondary.
So I want to go to the next question, ask both of you a little bit more about what are you thinking about for next year? And let's go to the next slide. And especially the start of the beginning of the year, which is here before we know it. For some places, it's already started. And how, because what we talked about is you think about a tiered support approach, you think about what you're going to do, but then you got to use those insights from kids and families to tailor and modify what you were planning to do to make sure that what you're doing responds to that. So either one of you who would like to go first, what do you think about for next year, and how does that reflect insights you know from talking to kids and families?
So for us, for about the last 4 years, we have been sharing our professional development time with parents. And so we are learning as a community about different strategies, and we're empowering parents with knowledge about what's going on in the building. And so we'll spend a half a day in a conscious discipline training with parents are invited to attend. And we actually we systematically look at the barriers to participation, like childcare, transportation. How are we getting parents to the school to be able to participate? And then we end with a huge celebration of family through a community barbecue. And it's not necessarily a time to gather information or collect data or problem solve. The barbecue is purely relational. And so we have 2 long tables that seat about 300 people on our football field. We have music so kids can dance. We have a photo booth, and our school board comes out and serves the barbecue to our families. And the the key goal is to build relationships with the families in your community, with your staff, and then also with practitioners and community partners.
You know, Erin, one of the things we've seen happen during the pandemic is some of the practices like the one you just said got lost because we got so fearful of the pandemic and COVID that we stopped inviting families to show up in person. We stopped holding those gatherings. We stopped, you know, letting families even come on. And so curious, Erin, have you had to do anything to reestablish and make sure that people know that this is a good, healthy thing to see each other and build relationships in person?
So we did shift to doing quite a bit of our learning during COVID times outside. And so inviting families to participate outside, which was logistically a nightmare, but it worked. But you know, to be really quite honest with you, we have such a small district that we do personal invitations. I call just about every family that I have in my district and know them by name, know most of them since they've been 3 years old in preschool, and personally invite them to attend and reassure them that, you know, we're taking safety precautions and doing what we need to do to make sure that they're safe to participate.
Thank you. And Naomi, what are
Yes.
your
How much am I having now? So again, parent engagement, has been a common thing too that we've been talking. Right after COVID, we realized that our families were not feeling as welcome in our building. So last year, what we did is that we started to do what we call our FA, which is our parent conference. So instead of a back to school event of one night, we're having 3 days of family advocacy days. So parents can come, meet the students, know the schools, build relationship. So we give parents the opportunity of 3 days. One of them is one of the days we stay up till late that day. So parents can come and again, build that relationship, and there's not rush on like one day come meet your staff, but they can do it. Some schools schedule them, some school they're just open, just come, and that has helped us a lot. It was amazing last year, so we decided to do that again. Now we're using that as an opportunity to share education about why attendance is important. One of the things, and I know we were just talking about that, is that one of the things that in our cafes come up was a question of like, when can I bring my student to school, right? And that has been something that I know a lot of schools have asked. So we have a lot of parents and staff that have asked us that question as a district. I need direct and clear guidance on when my student can come to school when related to illness. So we are working with a health director to make sure that we're providing that information to parents during those first 3 days of FA days at the beginning of the school year. Another thing that we're doing is that we adapted the student success plan that Attendance Work has. We created one for us, and every student who was chronically absent last school year, this year during those FA days, they will create a success plan with the parent and their teacher, just to be prevented and making sure that we're identifying those barriers before the school start, right? Making sure that if there are any barriers, that we're connecting them to resources before the school starts. So those are some of the things that we are doing. And then as buildings, making sure that every building has an attendance plan for the school year.
Thank you so much.
Yeah.
I would like at this moment to invite Elliot, Gloria, Kwesi to all join us as part of and maybe what we can do is stop sharing slides so that we can more see our pictures. And then we can also talk about some of the questions, but I don't know if Kwesi, there's something in particular that you're seeing that you wanna tee up for us or observations as we move into this Q&A section.
Thanks, Hetty. You know, I think there is a question I want to have the panel answer. I mean, I think one of the things aside from access to resources, et cetera, that some of you have mentioned, there are just a number of questions about complex problems that schools, frankly, were never designed to kind of address on their own, like homelessness, you know, poverty, all of the usual kinds of challenges and root causes. And one of the things that I think you guys have each touched on in your own way is that part of the strategy is no one entity can tackle this problem on its own. So you need partnership. You know, there is a federal pot of money for homeless kids and families. It's worth exploring if your district is not using its McKinney-Vento, money on that. We also heard from Elliot that, a great many students are out chronically absent because of health-related issues. A school knowing a kid's asthma action plan is important, but obviously that's a medical plan. It's not something that the school would deal with. The school could be given access to it. So the more that we have partnership, the more we work together, the more we're in relationship across agencies. It's one of the reasons why, for example, in some places, the housing department is part of the coalition is working on chronic absenteeism, because we know in many places inadequate housing and homelessness is a major issue that is causing chronic absenteeism, and that they are part of the solution. I'm curious, there was one question I was very curious because there was from Riverside, California, there was a mention that the crime prevention unit was working on chronic absenteeism, which suggests to me most of the time a crime prevention unit is in a police department. So that was curious. Of course, we know chronic absenteeism is a challenge and a problem, but it's not a crime. But what's the appropriate role for law enforcement in this? Gloria, you have more of a national view, and Naomi, I don't know if you have any local examples, but to what extent is some of your work in partnership with law enforcement around and Hetty, you should weigh in as well on the the appropriate role for law enforcement as part of the solution without criminalizing the issue.
Quincy, I'll jump in only because this came up actually when we were chatting about our findings with some of our high school, specifically high school district partners. I think that's a really critical question that really has to be embedded and ingrained and responded to in the context of the community, because criminalizing, especially for Brown and Black children, their engagement in the justice system has serious consequences that extend beyond kind of educational opportunities. So I think that's a really important question. I will tell you that when we ask families very specifically about this issue, any engagement, and again, you have to keep in mind, this is the communities that we serve, that any engagement with like a government entity already kind of predisposes a lot of concern, a lot of resistance and safety issues that are indicative, whether because of immigration concerns or a trauma, quite frankly, in a community. So our response really and our guidance to our colleagues is think about what resources do you have in place for that relationship to perhaps be preventative in a more constructive home visiting kind of way, recognizing obviously that there can be a very positive relationship that can be generated, but it takes time and it takes a recognition that families might have a very important reaction or perspective to hear. Because I will tell you, the superintendent was like, we need to bring in the campus police, and parents being like, never, don't do that.
So
right?
I also want to distinguish, because we're getting a few comments in the chat, and I've seen this. There's a difference between having law enforcement be the front lines, which Gloria is saying, be very careful. That may just make everyone else never show up to anything because they're worried about that, to law enforcement being part of a coalition and playing a very productive role. In California, and I saw something someone talked about their crime prevention unit is to prevent families from going into the pipeline. I've seen juvenile court judges ask tons of questions because they're like, you never got the support you needed on site at the school level. This should not be in the court system. So I think we need to distinguish between how you involve law enforcement as part of a system where they're actually helping advocate for, push for prevention-oriented work, and maybe at the public officials, versus are you in the front lines and the first person to do outreach, which is both probably way too expensive because cops are expensive and don't have the desired effect because they make kids and families feel really nervous. So I think you really need to think about this. Naomi or Aaron, do you want to add anything to this?
I'll add really something really quick. So at KCKPS, one of the reasons of students in high school, secondary, were not coming to school came out because they were not feeling safe in schools due to our violence in the community. That was a common. So we created this initiative that is actually under Attend to Achieve, but people don't know that. But it's called Enough is Enough. And it's an initiative where we include our chief of police or director or coordinator of behavioral services, includes board members, and we talk about what are the community. We did 2 years of listening sessions about what the community needs to feel safe in our schools. And one of the things that they share with us is that they wanted something student-led. So last year we created a student advisory group at each high school. And what we do is that we do a leadership program, and we invite the police and we invite people in the community to have conversation with our students about what they can do. So they're leading the work around safety in the schools, but these people are, everyone in the coalition is part of the conversation. So I can share if anyone want more information about Enough is Enough, you can Google KCKPS Enough is Enough, or I can definitely share more information because I know I don't have a lot of time to share it. But again, listening to what the student needs, right?
Thank you. I'm going to do a bit of a shift. I want to go to Aaron and Elliot on this one. Aaron and Elliot, the question is, how can we support families with kids in pre-K? And I'd love for you to talk about that from your experience. And then Elliot, you can talk about a little bit of the health-related strategies there too.
So support families as far as recognizing that school and attendance matters. And so what we do in our district is we start from 3 and talk about attendance and talk about the importance of attendance. And we start that education piece early. And again, sharing not only for academic gains, but also for building strong community. And so we start with a very relational approach. We have 2 or 3 home visits before kids even come into the preschool building. And we walk alongside families as they're either relearning new habits that maybe they may not have had school attendance prioritized in their families, and we're helping to establish new habits, or we're supporting them to learn about the health piece. I mean, and when kids need to be excluded and when they're not excluded, and ensuring that they feel empowered and understand the implications of attendance.
Elliot, what would you add to that?
Yeah, so all great points. Prevention is key. So the earlier that we can identify screen kids and identify issues, the earlier we can address them, so that when they get into elementary school, those issues are brought under control, or the family's provided with the necessary resources, screening for developmental issues, identifying chronic health issues, making sure that kids have a provider, they're getting their annual checkups, their dental visits, etc., that they have their medications to keep their health issues under control. If all of those things are in place, then when that child shows up to kindergarten, and you can make the really important part is, and this takes a lot of coordination, but if there can be some type of handoff from preschool to kindergarten, what are those health issues? What is that child's what are the issues that child is dealing with? What are the supports they're currently getting, so that the school can continue to support that child and family with those same resources? That transition is going to be so much more successful, and you're going to be much more likely to keep that child in school.
Thank you. Naomi, there are a couple of questions for you. One is, can you share your attendance plan? And if it's a yes, then we can just let people know. And there's also a question about, and I'm going to do it to you and Aaron a little bit, which is, how do you deal with teacher resistance to this? Like, how do you make sure teachers are bought into this? So first, can you just answer the attendance plan question, and then talk a little bit about how do we really engage our teachers?
Absolutely. We are getting ready for the back to school. So some of the links in the attendance guide are being updated for this school year, but all the links for the attendance plan, attendance resource are attached to the attendance guide. So you have the attendance guide, just give us till Friday and all the links will be live then. So you will have that. My team is doing some editing in there. It's still back to school, but you have that. Teacher, you know what? Those are actually are great questions. You know, teachers are the front and the ones that build relationship with our students. So one of the approach that we do is, so we have the what we call, and someone asked is, what is FA, the Family Advocacy System, where every student has an advocate assigned to them, which is some school have it, it's called it the homeroom, right? Depending on high school and or depending on the grade you meet with them. So what we have done is like we talk to those, we do professional development about around family advocacy. We just do a lot of professional development and we talk about the importance of building relationship and the impact that that does to attendance. I think with teachers, you know, teachers are very overworked. They have a lot on their plate. So you need to help them and we need to remember the why. I forget sometimes, you know, so we need to constantly remember the why. But then the other thing is that have the resources easily accessible for them. They need to have resources that they can access quick, that they can just print, that they can utilize. So making sure that you have things easy for them to use because they don't have the time sometimes to create those resources. So that's why we created the attendance guide so they can access to all that information quick and they don't have to work much and they have it there.
Erin, what would you add?
So thank you for bringing up, Naomi, the remembering your why. And this is going to go, you know, we have been so focused on ensuring that our school feels safe and connected for our students that my job as a leader is to really make sure that our staff feel safe and connected. And I am assuming positive intent. And maybe I'm a little bit rose-colored glasses, and I'm lucky because I have 13 staff that I have to supervise. But I really truly believe that the teachers in this building want successful students, and they find joy and they find their why in when they see their children succeed. And so as we're educating parents about the importance of attendance, we're also doing the same thing with our teachers and saying there's a direct correlation between coming to school and you feeling successful in your job. And so how are we supporting that? And the easily accessible resources and having a system in place that's easy to navigate for teachers and supporting them when we can, and ensuring that, you know, that they're able to come to us and ask questions and ask for support when they need it. And so I'm very hands-on. I meet with parents and teachers together so we can have you know, critical conversations about attendance and reducing barriers and build relationships. And I model that to my staff as well.
So we clearly could go on for another half an hour, but we don't have another half an hour. I'm going to ask the IEL team to pull up the slides, and as that gives a few more resources that we just want to make sure that everyone knows about. This is the year-round planning calendar that we developed. You'll see in the Kansas City guide, there's a kind of an adaptation of some of this for the school level. If you go to the next slide, we actually have a school level too, but they adapted it further. So no, you can take and tailor our resources to make them work for you. This is our attendance awareness website. We have new social media memes. Catherine Cooney, who's on this webinar, has been working so hard to update this. Our new proclamation, you can join our listserv, and that way you'll get access to everything. Next slide. We also have our Count Us In toolkit, which again has some new updated resources. We try to update it for every webinar, and it also has a little what to do when, if you're feeling a little overwhelmed about how much you have to do, it helps to time orient this one. If you go to the next slide, you can also promote us using social media. We really encourage you to do that. Next slide. And remember, we have a brand new proclamation. So as Kwesi said, can't do this alone. Your mayors, your city officials, they also have access to resources. That's part of the sustainability. Having a more collaborative approach is so essential as we see the shift away from, you know, COVID relief dollars to really having to have sustainable approaches. Next slide. And want to make sure you keep in mind the showing up matters for real, because it's when we can explain why kids should still show up. It's about routines, engagement, access to resources, and learning that we can still get kids there. Next slide. And please, please, please let us know how you can improve. And I'm going to turn us back to Kwesi to close us out.
Thanks, everybody. Sorry we couldn't get to all of your questions. Lots of great ones. We'll get to them on the next go round, and you'll get all the resources, links, etc. within several days, and you can find them on the Attendance Works website. And I think that's everything. Yes, yes.
I think we just may want to do a couple thank yous. So one
Yes,
more.
yes, yes. Next, special thanks to our philanthropic partners, Heinrich Simons Foundation, and individual donors. Next slide.
And I think that may be it though.
Okay.
And I want to just say thank you to Kwesi, to LaShonda, to Pele for all their support. And then our amazing panelists, Erin, Gloria, Elliot, Naomi, and then Hisela, who's been behind the scenes helping to orchestrate all of this. And thank you to all of you in the audience. We need to keep this up, keep advocating. We need to keep the work going on. And this timing of year makes this work more essential than ever. If we don't start with this foundation of welcoming, connecting, supporting our kids and families with resources in this positive approach, next we'll be in deep trouble. And I know the folks on this webinar are the ones who will ensure that we are going to create a brighter future for our kids.
Take care, everyone. Be safe.
Thank you, everyone.